Chapter 7.
Is it the skeleton?
No, it's the bones.
Good thing it's Thursday. I've had about enough of you.
Why is he holding a shovel?
Okay, so for chapter 7, yes?
I said, why is he holding a shovel?
Oh,
That's kind of creepy.
He's doing his own thing.
here you go, here you go. So, for the lecture test, okay. Oh, where's your Bio 241 worksheets? So, for the lab exam number 1, it will just be all microscopes. But for lab exam number 2, so after these pages with the circles, the next, you see this one right here? After the circles, you see this one? Bio 241 bone structures, you see that? This one, you should look for this. I have a skeleton and I have this articulated skeleton. So your next lab exam will just all be bones. You're going to move from one to you label, you identify, look for all of these structures in your bones. Okay, this will be the scope, or this is what I'm going to use for your lab exam. Okay, that one. Okay, now for the lecture test, I just want you so far for lecture. I just want you to be able to name the big bones. The individual bony markings will be tested in the lab exam. Clear? Let's study our bones. What's this?
Cranium.
That's very good. Okay. If you write skull, I will mark you wrong. Okay? The whole thing is the skull. But this is pointing to the cranium. This is your facial bones over here. Again, for lecture test, cranium, not skull, cranium. Besides, this cranium is still made up of many bones. You have your parietal, frontal, occipital, your temporal bone, sphenoid, ethmoid. So there's several bones that make up the cranium. But for lecture test, cranium, okay. For lab exam, all those individual bones, that's what's going to be tested. You understand? And then lecture test, here, you write facial bone. If you know, what's this one?
Mandible.
Yeah, if you write mandible, then that's even better, right? But facial bone, cranium, what's this?
Sternum. Those.
Ribs, yes. What's this?
Sternum.
Yes. Okay, and then this one, don't write vertebrae.
Thoracic.
Here, this is your
Cervical.
cervical, thoracic, lumbar, sacral. So that's why. If you just write vertebrae, wrong. Okay? Because you're by 241. Okay? So you need to know that. Next, I'm also combining both now, preparing you for the lab. Now, for the lab exam, if there will be bones of the, oh, first of all, before we do that. Next, what's this one? This is your intervertebral disc. Okay, so if it's pointing here, that's the intervertebral disc. That's not, is this bone?
No.
No. So if I made a slight preparation of the intervertebral disc, will I see osteoclast?
No.
No, not at all. You won't see the lamella, nothing. It's not bone. It is actually fibrocartilage, which you have a sample there. That was taken from the intervertebral disc. Okay? What's this one? Pelvis. If you write hip bone, you're wrong. I will not. Yeah, you can write ilium. This is the ilium. There's your pubis, and this is the ischium. Very good. Okay? And then this is your humerus. And then this one is your radius, because there's the flat facet. Okay, radius. And then this is your ulna. These are your carpals, metacarpals, phalanges. This is
Clavicle.
If you wrote collarbone, wrong. This is,
Scapula.
yes, wing bone is wrong. Okay? And then this one is femur. This is your patella. This is your
Tibia.
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 In the test, if you wrote fibia, tibula, I'm gonna mark it wrong. It's driving me nuts. You write letter T, tibia. This is F, fibula. Okay? And these are your tarsals, metatarsals, phalanges for lecture test. Because look at, there's several tarsals. You have your calcaneus, your talus, your naviculars. So there's several of them. So the individual carpal tarsals, they will be tested in your lab exam. Do you follow? You should also know that the bones of the skeleton are divided into two divisions. There are the bones of the actual skeleton right here on the right to your left. The one that's color gray, that's your actual skeleton, actual division. In other words, the axis, the center, beginning with the cranium all the way down here. This one is actual skeleton. And then the bones of the appendicular skeleton actually are your upper and lower limbs, plus the hangers that anchor them there. So you have your clavicle and scapula, which is appendicular, and same with the pelvis. So this, pelvis, and this clavicle, scapula, they make up the appendicular skeleton. Okay? So you should know those. Okay, for the lab exam, let's go look at your skull. My favorite for the skull.
What lab exam is this one?
That's gonna be lab 2. I have a done.
My favorite for the skull is number 1, fontanelles. Where's my fontanelles? What's the function of fontanelles? Again, you should know the function of fontanelles. We discussed that already. Okay? Where's my, right there, fontanelles. I like to ask that in the test. Okay? What do you think? If I did a slide preparation of fontanelles, will I see bone? Yes? Who says yes? Who says no? Very good. It's still membrane. Okay? Another favorite of mine in the skull are your paranasal sinuses. So in the lab exam, okay, what you will see will be the bones. And like this one, I have 2 of these that has the square openings. You see that? Another square over there. Those are your paranasal sinuses. So what you will see is the skull like this, and there will be a pipe cleaner coming out, and I'll ask you identify. So you're going to write down, that's a paranasal sinus. Paranasal means all around the nose. It's very important. The paranasal sinuses, the function of paranasal sinuses is to lighten your skull. It's very heavy. If it's all dense with no cavities in there, it's going to be very heavy for you to carry. Remember, we are going against the pull of gravity. Okay? So, and besides your bone is made up of living cells. Okay? So this one helps to drain, waste or cell debris, waste from the cells here, you drain it. And when there is a blockage to the drainage, then you have sinusitis. And you notice people with sinusitis, they complain of pain here, here, even here. In their teeth, they say painful in the teeth, because it's all around. That's where you find your sinuses. So what by the way, is the product? What do you call it?
Mucus.
Yeah, made of what?
Protein.
And so how do they make that again? Protein synthesis. You see how protein synthesis is just the basic of the life of every cell. Okay? So yes.
How come it says skull on that? And we're not supposed to use the word skull, I thought.
I said the skull is made up of 2 parts, right? So for me, I don't like to see. I just want to know that you know that this. Yes, I know that this is all
Just the
skull.
scientific term.
I know that this is all skull. But if it's pointing here, I want you to write cranium.
Okay.
Here, I want you to write facial bone. So I know that you know. Okay?
Okay.
It is correct. It's count.
Okay.
But for me, I'm going to mark you wrong because I'm pointing specifically to the cranium.
If you put brackets over the whole head, it would be like this whole.
Yes. Okay, now vertebral column. So what do I want you to know about the vertebral column? Again, don't forget your bony markings. But this is lab number 2, okay? Not lab number 1. Lab number 1, microscopes. Okay?
That one's over 28.
Yes. Okay? Next, here, your vertebral column. So, I want you to know your normal vertebral curves. The primary and the secondary vertebral curves. What are the primary curves? This is your primary curve, and this is your secondary curve. You know when the baby is born in the fetal position like that?
Yeah.
Primary curve is the thoracic and the sacral. That's your primary curve. And then about 4 months, you notice the baby starts lifting the head. So that's a secondary curve. And then lastly, about 1 year, the baby starts standing, walking. So you have the lumbar curve. That's a secondary curve. Okay, very important for us to understand or to know this one. Abnormal curves. Why are we required to know this? So I hope you know this. Scoliosis. Do you know what scoliosis is, right? The letter S. You know kyphosis, the hunchback, and then lordosis. Please know these abnormal curves. Why are they called abnormal? Do they have a bad effect?
Yes.
Yes, right? If they don't cause anything, any difficulty, we won't have to worry about them. But they cause something. Can you give me some examples of what these abnormal curves can do to you?
I can create back pain.
Back pain, yes.
Cut off your nerves.
Very good. Nerves. Look, very good. Look at that. Look again. You remember spinal cord, right? So this, by the way, so there are 2 openings here. I'm just preparing you for your lab exam, okay? This is your vertebral column, right? Sorry. This is called the vertebral foramen, and you know that the spinal cord passes through here, which is nervous tissue. This is called intervertebral foramen, in between the vertebrae, and you know that the nerves come out there. So, like you said, the nerves. Can you imagine if there's an abnormal curve? That's going to cause a compression of the nerve, and that's going to, nerves are the ones, isn't it the key for muscles to contract, right? So, besides pain, there will be weakness also. Going to be difficult to move the muscle that's being stimulated by that nerve, right? Number 1. Number 2. What else do you think? Disability, yes, yes.
Paralysis. Sorry. When I worked for a chiropractor, one thing that he said, when you have a bent back like that, it actually it messes up your function between your brain and your organs. So you can actually have deficiency in your organ production and messages between your brain and
The nerves. Now, yes, that's it, the nerves. And also, what do you think? What's here? What's here? In your,
your heart.
your heart, yes, you're breathing. What do you think? Okay. Must be having difficulty for breathing. Don't you think so? And then there's a reason why we're supposed to have this kind of anatomy, so that did you know that when you breathe, you're supposed to expand the lungs, right? Expand the ribs so that you can breathe. Can this expand properly? No. So they will have problems. So that's why we need to. And how about this one, right? The abnormal curves. So that's gonna be. That's why they complain of back pains, right? Because you said the nerves can be compacted, and so not compacted, compressed. So you see, that's why if you have kids, that's one of the physical exam for children, right? They have to take off their clothes because they want to see. You want to look at the curvature. and you tell the parents if there's abnormal curvature, we want to monitor her. Now it's just mild, but we want to monitor because if the patient, if when he grows and the curvature becomes exaggerated or more pronounced, then you explain to them. You go to your anatomy, you have organs here, you explain to them what's here, the nerves. So if I ask you in the test, you can explain to me problems, right? You can predict problems with these abnormal curves, okay?
Spina bifida.
Spina bifida is different. What's spina bifida? It's,
Fluid buildup or something?
what is spina bifida? Fluid buildup, yes, but spina bifida is what? That's correct.
What is it?
A hole. It didn't close. So it didn't close properly. So it's exposed. You see those babies with like a cyst coming out, a bulge. I'll show you spina bifida.
I had a friend that, like, in her mid-30s found out all of a sudden she had to get, like, some spinal weird surgery that she'd had all her life that needed it. And I don't know, it's weird.
See? The spina bifida
Oh
there.
my god.
The babies, the spinal cord didn't close. No, the vertebral column didn't close. That's usually what's going on. It didn't close, so the meninges, it pops out and it can cause nerve
Is
damage.
it like a hernia kind of?
Like a hernia, yes, it's like a hernia. Okay,
Sorry.
now we go back to, as far as the individual vertebrae is concerned, for your lab exam number 2, what I like to do, I have individual vertebrae on the table, and you just tell me, what is this? You don't need to tell me this is L1, L2. You just need to tell me, is it lumbar, thoracic, cervical, this one over here, okay? And it's very easy. Look at cervical. Cervical vertebrae is the only one. Look at the spinous process of the cervical. It's bifid. So it's the only one that has a bifid process, and you know it's smaller. Thoracic. With the thoracic vertebrae, the spinous process is pointing down. And the lumbar vertebrae, the spinous process is pointing directly at you. Okay, so you just say, this is lumbar, this is thoracic, this is cervical. However, for the cervical vertebrae, I am very strict with the first two vertebrae, C1 and C2. C1 and C2 are unique. See, you see this one? There is C1, the atlas, and C2 is the axis. This is shaped different from the other vertebrae. So if this is the one that's on the table, you say this is C1. C2 has that, see the dense promontory that sticks out? So this two, if that's the one that's out, you say this is C1, this is C2. The rest, I don't care, you just write cervical, thoracic, lumbar, sacrum, okay, no problem. These are very important because they're the ones that help us, make us nod yes, shake our head no, because of that, see? Okay? And then I like to ask about this one, the intervertebral disc. So you should know the function. You know of the herniated disc, right? Why is it so painful? Now you understand. It's the same principle as the nerve, right? If this herniates, so if the disc herniates, won't that compress this? This comes out, so this bone on top compresses with the bone on the bottom, and what's going to be affected will be the nerve that comes out right here, right? So that's why they complain of severe pain. You see? Okay? I like to ask about the function of the intervertebral disc. You should know the function of the intervertebral disc. And as far as degenerative diseases or old age problems, which level do you think will always
Lumbar.
suffer first? Yes. Why?
Gravity.
Yes, the weight, right? That's why we don't want to gain too much weight because it's too much stress on our lumbar vertebrae. Okay, that's the one. I like to ask that, okay? Yes.
Is damage to like the herniated disc and all that, or is that irreversible?
The herniated disc,
Like let's say if
irreversible.
you damage part of your spine. it's obviously your cells can't fix it. And
Your cells can, but there's so many things going against it. With the vertebrae, really, it's going against gravity. Number one. Number two, it's just bearing your weight. So that's why when you have a damage here, they just go ahead and do It's very hard to solve problems with the back. They just do surgery. They do the what do you call them? What do you call those things that they put in there?
the rods.
The rods, right? They put the rods in there. For the main reason, the main reason is that you can't sit still. You just want to walk because we're meant. That's what human beings do. You walk, and it's very hard to heal that part. You're constantly putting pressure on it. You're not giving it time to heal. So they just do.
Pregnancy,
Yes.
pressure.
Of course.
I had a pinched nerve.
Oh, you are you got pregnant already? Are you serious?
She looks so young.
She does. What? Oh, you're so blessed. I thought you're like a teenager. I can't believe it. Wow. Yes, pregnancy because look at, right? Right? And then there's that pain over there. As far as pregnancy, we're going to talk about one more thing about pregnancy, but let's go to the pelvis. Okay, the pelvis. My favorite with the pelvis is this foramen over here. Right here. See? You see this foramen? It's called the obturator foramen, this one. So this obturator foramen is very commonly injured or affected by childbirth. So females, because what comes out of the obturator foramen from your vertebral column, from your spinal cord is the obturator nerve, and so it passes here, and the obturator nerve becomes femoral to innervate the medial aspect of our thighs. Some females, when they give birth to big babies, as the baby is delivered, that obturator nerve is permanently damaged because of the bigness of the baby. And so then mothers, once they're done delivering that baby, sometimes after a while they complain that they don't feel anything here in the medial aspect of their thigh. That's because of damage to the obturator nerve, which is very common in pregnancy if you have a big baby. I want you to be able to differentiate a male from a female pelvis. Okay? And it's very easy. Look at. Sometimes I'll have a skeleton there and I'll say, tell me if this male or female. Look at. A female is wider. Makes sense? Because so we can accommodate the baby. Male, more triangular in shape. And look at the angle of the pubic arch, wider, acute, more than 90, less than 90. Look at the bone, the tailbone or the coccyx. In males, it is more. See, look at the coccyx in males. It's more pointing inwards, whereas in females, it's all designed to accommodate a pregnancy. So hopefully, it will be easy and these things, they're very important for us to know because maybe you go into forensics and you have maybe a skeleton that was dug and they want to know, is this a male or a female? So many things can help you. Pelvis is one of them. You see, I think this is a male. Just by looking at you measure all of that, you see, yes.
Just based on the way that the tailbone is set up on the males, do they have more sacral pain than females?
More sacral pain. That's a good question. Do you have more pain in the butt than
They are more bigger pain in the butt.
Do you have more pain in the butt? I don't think so. I think it's the same. We have both the same. It's just that for us, our anatomy is designed to carry pregnancy. The way the female gait is different from the male gait, and I think that's all also in relation to their anatomy. Okay? Okay, next, let's go to chapter 8, which is your joints. Oh no, what did I do? Did I just... There you go.
You know. I think she's 4, 5, 6, 7. I mean, yeah, that's three, the next three, and then that's why she did this certain thing. Those early tests. And so now we're on the third.
So our joints, this is the last part of your skeletal system.